Hello everyone and welcome to a new episodes and today we are going to speak about medical terminology. Medical terminology considered one of the important prerequisite course for any student willing to enroll in the medical school, enroll in physician assistant program, enroll in the nursing program or in the pharmacy program or any healthcare program. So this is an important session for the anyone who is willing to enroll in the university healthcare program. So your guidance for understanding medical language, medical terminology refers to the specialized language used by healthcare professions to describe the human body, to describe the human body functions, to describe the human body diseases or procedures and treatment. Okay, so medical terminology consists of the three main parts. As you can see here in this slide, we have prefix, we have root, we have suffix. So the word part divided in three main part, prefix, root, and suffix. Okay. We give you some definition here for the prefix. What is the prefix? Prefix, this is terms appear at the beginning of the word, indicate number, indicate size, indicate location, could be color. We are going to give some example that help us to understand the prefix, and we in this session we are going to focus on the maybe main medical terminology, and in the next following session we can expand more in the medical terminology. So the example for the prefix here, we have hyper. As you can see here, we have hyper, and hyper mean high or elevated. And example here, hypertension. Hyper here, the first one, the first part, hyper prefix mean high, tension mean pressure, and the meaning will be high blood pressure. So if I put it on the Google images, you can see here I have hypertension, and they try to tell us everyone with the over 130 over 80 considered like suffer from high blood pressure or hypertension. Then they try to show us the blood around the vein, and high blood pressure may affect the heart. So this is the first medical terminology, hypertension, which mean high blood pressure. Okay. Moving to the second medical terminology, we have cardiology. Cardiology, the middle part of the word here, as I mentioned, the root of the word. So the first one was prefix, which means the first part of the word, such as hyper from hypertension. Then we move to the root. The root, the middle part of the word, identifies a part of the body or the subject. We have example here. We have cardi. Cardi mean heart. The word meaning here cardiology, and cardi mean heart. Logy means study of. So meaning study of the heart. Another word we have gastroenterology. Gastro means stomach. Enterology mean intestine. And urology means study of. So we have another example for the root, for example, gastroenterology. We have it in the next coming slide. So cardiology. Okay, you can see here when you talk about cardiology and put it in the Google images, you can see the cardiology mean a study of the heart. Okay, so the card mean the heart, cardi, and logy means study of. So you can see here when you put cardiology, so they show us the heart in different images, different picture, different function. Okay, next we have suffix, the third part. So the first part was prefix, the second part was root, and the third one was suffix. Suffix appear at the end of the word and describe a process, amount, location, and we have an example for that, ectomy. So ectomy, surgically removal, and we have the example here, appendectomy. Appendectomy is the parts of the word. Append stand for appendix, ectomy mean removal, and meaning surgical removal of the appendix. Okay, through the Google images here, when you type appendectomy, they show us the images, and you can see here the appendectomy at the last part of the colons, and you can see the appendix here, and it's like surgical removal of the appendectomy. So we have several maybe images that show us the appendectomy, which mean removal of the appendix. Okay, in the next coming slide, we are going to give some full word example related to the medical terminology and very often seen in the practice. Okay, the first word as an example, hypodermic. Hypo mean under or low. Derm, root derm will be skin, and suffix pertaining to. So the meaning will be pertaining to under the skin. Hypodermic needle. Another word very close and similar to this word, subcutaneous. So we have hypodermic, hypo under, derm skin, and at the end IC mean related to. And we are going to give you some images to refresh your mind about this image, hypodermic. Okay, you can see normally when you use hypodermic, that means we are going to put something under the skin, hypodermic needle. And you can see here the needle is very small. We use it for hypodermic. And we insert the needle under the skin for the epidermis. And you can see this image here to show us this is the hypodermic here, the first one. If you click on this image here, okay, you can see the hypodermic, subcutaneous. This is a subcutaneous here, under the skin. Next word for medical terminology, we have bradycardia. Brady mean as a suffix, slow, card related to the heart, or the root of the word, and suffix aya, bradycardia, and mean condition. So bradycardia mean where the heart beats slower than normal. So here we're talking about bradycardia. Someone may be interested in knowing more about bradycardia. Here means slowing the heart rate, the bradycardia, as you can see here. So you can see on the EKG, we have the normal blood pressure here, and this is the normal blood pressure, the first one here, normal blood pressure. If you click on this image here, and this is the normal blood pressure. And when the patient suffers from bradycardia, you can see the distance, the space between the QRS component. And this image here shows us the bradycardia. So we have long distance between every QRS. Okay, moving to the another medical terminology, tachypnea. Prefix tachy mean fast, root pnea mean breathing, and the meaning will be rapid breathing, tachypnea. Okay, we have here some maybe definition, some images, and we call maybe the people who suffer from tachypnea when they have more than 20 respiration in 1 minute. So tachypnea, and we have the diagram here, and you can see the people unable to breathe, and they have accelerated tachypnea or like rapid tachypnea. Okay, next to medical terminology word, hematemesis, which mean the vomiting blood. Hemat mean blood, the prefix. Hemat mean blood. Root, emesis mean vomiting, and the meaning will be vomiting blood. Hematemesis. Okay, through the Google images here, you can see here the hematemesis when the people maybe throw out some blood from their mouths due to the bleeding in the GI system, gastrointestinal system. If they have, for example, perforation, if they have ulcers, or any other pathophysiological issue. Okay, next word, endoscopy. Endoscopy, endo mean within or inside. A prefix, endo, within or inside. Root scopy mean viewing or examining. So the endoscopy, it's a procedure to examine the inside a body part using a scope. Okay, here you can see the Google images. They show us the endoscopy when they use a microscope to maybe to examine, to investigate what happened in the GI system, for example, here. So this is endoscopy, and could be, we call this one upper endoscopy. We have lower endoscopy. You can see here the colon, colonoscopy, and we have upper endoscopy. So coming from the mouth to the stomach and intestine. This is the upper endoscopy. We have colonoscopy through the colon for for the investigate the colon cancer. So endoscopy, another terminology, important terminology. In endoscopy, endo mean inside, scopy mean viewing or examining. And meaning of endoscopy is a procedure to examine the inside or part of the body using scope. Okay, next word, polydipsia. Poly mean many or excessive, and dips mean thirst, and ia mean condition. So the meaning will be excessive thirst, often symptoms of diabetes. So polydipsia, poly money, and dips mean thirst, and the meaning will be excessive thirst during maybe in patients suffer from diabetes. So here when we type here polydipsia on the Google image, you can see the people willing to drink a lot of water. They are excessive thirst, and they are try to drink a lot of water there. Okay, moving to the next word, osteoarthritis. Osteoarthritis, prefix osteo mean bone, root arthur, a joint. Then suffix itis mean inflammation. Osteoarthritis mean inflammation of the bone and joints. So osteoarthritis, osteo bone, arthur joint, itis mean inflammation, prefix, root, suffix. So here we are learning three terminology, prefix, root, and suffix, and the meaning will be inflammation of the bone and joints. Okay, in this Google images here, you can see some pictures for the osteoarthritis. Osteoarthritis affect the knees, affect the hip, affect the hand. When you talk about rheumatoid arthritis or orthopedic, for example, here. So we have some images and more images coming from osteoarthritis. Next medical word will be hypoglycemia. Hypo mean low or decrease, glyce means sugar, emia mean blood condition. The meaning of hypoglycemia will be low blood sugar. So when someone suffers from hypoglycemia, mean low blood sugar. Hypo mean low, and glyce mean sugar, and emia mean blood condition. This reminds us with the opposite word, we have hyperglycemia. So we need to remember that we have hypoglycemia, we have hyperglycemia. So when you talk here about hyperglycemia, I will go back to the slide. Here we have hypoglycemia, then we have hyperglycemia, mean increase or high level of sugar. Okay, when you put it in hypoglycemia, when you put it in the Google images here, they show you the maybe some symptoms here. The patients are from tremors, palpitation, increased heart rate, sweating. All these considered like hypoglycemia, common symptoms of hypoglycemia here. So you can look on the image here what the patients suffer from: headache, shaking, sweating, hunger. All these considered like a symptom of hypoglycemia. Next word will be pericarditis. Peri as suffix. Peri as a suffix mean around. Root of the word card mean heart. Itis mean inflammation. So pericarditis mean inflammation of the sac surrounding the heart. Pericarditis. Peri around. Root will be card mean heart, and then itis mean inflammation. Okay, pericarditis. Here you can see the maybe the membranes are surrounding the heart, around the heart, suffer from inflammation. So inflammation with the membrane surrounding the heart, pericarditis. So again, this one another membrane around the heart, pericarditis. Okay, so we talk about the sac or membrane around the heart suffer from inflammation, pericarditis. Okay, then we have gastroenterology. Okay, then we have gastroenterology. I will show you, maybe allow you to listen to the pronunciation of this word.
Gastroenterology.
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 Okay, prefix for this word, gastro means stomach, root will be enter, intestine, and logy means study of. So gastroenterology means the study of the stomach and intestine. It's not enough. The study of the stomach, intestine, we have for talking about intestine. Here we need to remember with the intestine we have two main parts, small intestine and then we have large intestine. Large intestine, here we talk about colons. Okay, we have some images for gastroenterology here. You can see here we are talking about the mouth, the esophagus, the stomach, the intestine. Even we talk about liver sometimes. So you can see all the system here. It's belong to the gastroenterology. So speaking about the GI system, gastroenterology, stomach, intestine. Okay, another word related to the medical terminology, we have nephrectomy. Nephrectomy, nepher mean kidney as suffix, ectomy mean surgical removal, and the meaning will be a surgical removal of kidney. Nephrectomy. Nepher, kidney, ectomy, surgical removal, and the meaning will be a surgical removal of kidney. And the pronunciation for the nephrectomy,
Nephrectomy.
nephrectomy,
Nephrectomy.
nephrectomy. Okay, let me share with you some images for nephrectomy. As you can see here, for example, we have here, you can see here the nephrectomy, the removal of the kidney. Try to remove the kidneys when somebody suffer from, for example, chronic failure or end stage kidney disease. We call this one nephrectomy. Try to remove the total remove of the kidney or partial remove of the kidney, depends on the case. And you can see here we have some tumor in the kidneys, so we call this one nephrectomy. Okay, next medical word will be hemiplegia. Prefix hemi talk about half. Plege mean the root plege mean paralysis. Aya mean condition, and the meaning will be paralysis one side of the body, hemiplegia. And the pronunciation for this word,
Hemiplegia.
hemiplegia,
Hemiplegia.
hemiplegia. So you can see here we have some symptoms here. We talk about half of the body will be paralyzed. As you can see from this image, the same situation here. They show us what happened with the body. Half of the body will be paralyzed. We have several type of paralysis we talk about here. Okay, next word. Okay, next word will be subcutaneous. Prefix means sub, mean under or below. Cutaneous means skin, and oias pertaining to or related to. So subcutaneous mean pertaining to the beneath under the skin, beneath the skin. Subcutaneous related to the under the skin. Okay, subcutaneous.
Subcutaneous.
So we have subcutaneous here. Okay, you can see some images from the Google images here for subcutaneous when you use, for example, insulin for diabetes, subcutaneous. So we have small needle, small length, small diameter, and insulin syringes to treat the type 1 or type 2 diabetes. Okay, next word, intravenous. Intra as prefix mean within, root vein, it's related to the vein, and aus pertaining to or related to suffix. So the prefix intra, root vein, and suffix aus mean pertaining to. The meaning will be pertaining to or pertaining to within the vein. IV therapy, intravenous therapy, intravenous,
Intravenous.
Okay, you can see in this image here when the patient go to the hospital in emergency cases and the patient need like immediate intervene, and they put some IV fluid infusion in the veins, and you can see some so many drips here, and the medication will arrive immediately to the blood, immediately to the heart, immediately to the circulation. Intravenous. Okay, this will end this first introduction session regarding the medical terminology. In the next session, we are going to speak about medical terminology regarding the size and amount, regarding the number, regarding the location. For example, speaking about the size and amount, we have macro, micro, hyper, hypo, normo, ban, A and N. We have megaloblastic anemia. Then we talk about numbers such as mono, di, tri, quad, such as quadruple, polydipsia, oligo. Oligo mean the decrease or maybe none. Then we talk about location, ibi, beri, circumstances, for example, here. Okay, then we have location, endo, intra, and exo, extra, enter, and then we have trans, diabetes, pericarditis, then we have midi, then we have para and juxta. So in this next session, we are going to cover these abbreviations, prefix in three different approach. I hope will this benefit all the maybe student in healthcare who's willing to learn the medical terminology. Stay tuned and thank you so much for watching.